Welcome to the Tary Podcast, everybody. Season 1, Episode 3.
Right.
Today we're diving into the system tracer methodology in healthcare.
Very cool.
And this episode is brought to you by the Tary Quality Team.
Excellent.
For those of you who are just joining us, Tary is a medical health tech company. And this methodology really, well, it underpins a lot of the work we do to support quality improvement in healthcare.
Yeah.
If you're interested in learning more about Tary, you can always visit our website at tary.care.
Awesome.
Our goal today is to really understand the system tracer methodology,
Okay.
how it's applied, and why it's such a valuable tool for making healthcare better.
Yeah.
So we'll explore what it is, how it functions in practice, and look at some specific examples to bring it all to life.
That was great.
So to kick things off, why don't you tell us a little bit about the system tracer methodology and where it kind of fits into the larger picture of quality management?
Absolutely. So this system tracer methodology is deeply rooted in the principles of total quality management, or TQM.
Okay, TQM.
Now, TQM is often described as a commitment to incremental improvement. So it's about making consistent small steps forward rather than seeking those like radical sudden changes.
Okay, so this idea of incremental improvement.
Yes.
How does the system tracer methodology actually drive that kind of progress in healthcare?
Well, the tracer methodology is really the engine for that cycle of improvement.
Okay.
Think of it as a continuous loop. Measure, assess. Improve, measure, assess.
Oh, wow.
You're constantly evaluating your current state, identifying areas for enhancement, implementing changes, and then reassessing to see if those changes have had the intended impact. This ongoing process of evaluation and adjustment is what fuels continuous quality improvement.
I see.
And at its core, the driving force is always to elevate the quality of care for patients.
That makes sense. It's a very iterative approach.
Yeah.
Now, our briefing materials mention two distinct types of tracers, individual and system.
Okay.
Could you clarify the key differences between them for us?
Certainly, an individual tracer essentially follows a single patient's journey through the healthcare system, looking closely at all the interactions and touch points they experience.
Right.
A system tracer, on the other hand, takes a much wider lens. It's designed to evaluate how interconnected the various organizational systems and processes are.
Interesting.
So instead of focusing on one patient's path,
Yeah.
it traces a specific process as it moves across different departments and functional areas.
Gotcha.
And as we mentioned, our focus today is squarely on the system tracer.
Right. So instead of following a person,
Exactly.
we're following a pathway within the organization. What kinds of systems are we talking about in this context?
Yeah.
The briefing document gives a few examples.
Yeah, we see several key areas where system tracers are commonly employed. These include medication tracers, which examine the entire spectrum of medication management.
Okay.
Data tracers, which look at how data is utilized for quality improvement. Infection control tracers, which focus on preventing the spread of infections, and environment of care tracers, which assess the safety and functionality of the physical healthcare environment.
Wow. So it sounds like a system tracer provides a really in-depth look, almost like a live tour of how a healthcare organization actually functions in practice.
Absolutely.
It goes beyond just reviewing written policies, doesn't it?
It does. It's far more than just a surface-level check or a simple audit.
Right.
A system tracer is intended to be a thorough and dynamic evaluation of the day-to-day operations.
Okay.
The briefing document defines it as a methodology to assess organizational systems by following a process from its initiation to its conclusion.
Wow.
This really underscores that process-centered perspective, understanding how different parts of the organization interact, and sometimes where those interactions could be smoother or more effective.
Yeah. That makes a lot of sense. That idea of hidden dependencies is fascinating.
Oh, yeah.
It really highlights the value of looking at the bigger picture. But let's delve into some of the specific examples you mentioned. Starting with the medication tracer.
Okay.
How does that work on the ground?
The medication tracer is designed to follow the complete journey of a medication within a hospital setting.
Okay.
It examines all 8 essential functions of medication management to really gauge the hospital performance in this critical area.
Okay.
These 8 functions are selection, procurement, storage, prescribing, and ordering preparation, dispensing, administration, and monitoring.
Wow.
The tracer can actually begin at different points. It might start in the pharmacy, looking at how medications are received and stored, or it could begin by selecting a specific medication that a patient is currently receiving and then tracing its path both backward and forward through the system.
Oh, that's interesting. So you're not always starting in the same place?
Not necessarily, no.
Okay. That's a very comprehensive approach, touching on so many vital aspects of patient care.
Yeah.
What about the environment of care tracer? What's the focus there?
The environment of care, or EOC tracer, looks at all the physical and safety elements of the healthcare environment.
Okay.
This encompasses a broad range of factors,
Okay.
such as the hospital's HAZMAT policy,
Okay.
their procedures for handling hazardous materials, measures for infant and child security, any issues related to the maintenance and functionality of medical equipment, how they handle alarms indicating utility failures, and their response protocols, fire safety procedures, and their overall emergency preparedness plans.
Gotcha.
It's really about ensuring a safe and functional setting for both patients and the healthcare team.
So it's covering everything from preventing potential hazards to ensuring basic infrastructure is reliable?
Exactly.
That sounds like a wide scope.
It is a broad area, yeah.
Then we have the infection control tracer.
Right.
How is that typically carried out?
The infection control tracer uses a slightly different approach. While it can include some individual tracing related to patients with infections,
Okay.
a significant part involves direct discussions about infection control practices with staff during tours of the facility.
Interesting.
This allows for a real-time assessment of how well protocols are being followed. I see. There are also often group discussions that cover broader topics, such as the hospital's hand hygiene program, their methods for surveillance of infections, the specific prevention activities they have implemented, and how they analyze infection-related data to drive improvements.
Okay, so it sounds like the infection control tracer really emphasizes that human element
It does.
and seeing practices in action.
Exactly.
Now, the last example you mentioned was the data use tracer.
Right.
In today's data-driven healthcare landscape, this one seems particularly relevant.
Absolutely.
What does that involve?
The data use tracer is indeed very timely. It primarily involves interactive group sessions with representatives from various parts of the organization.
Okay.
This includes people from information management, clinicians, and direct care staff, like physicians and nurses. And importantly, leadership.
Gotcha.
The main goal of these sessions is to understand how the organization actually uses data to enhance patient safety and the overall quality of care. This often includes examining their use of statistical process control, or SPC, which is essentially a visual way of tracking data over time to see if a process is stable or experiencing unusual variations that might indicate a problem.
Okay.
The tracer also looks at how leaders utilize data for making key decisions, where to focus their improvement efforts, how they report findings, how they share important information across the organization, and what specific actions they take based on the data to drive tangible improvements.
So it's not just about collecting vast amounts of data,
Right.
but truly understanding how that data informs decisions and ultimately benefits patients.
Exactly.
Now, the briefing document also outlines the general process for conducting these tracers, mentioning review, interview, view.
Okay.
Can you walk us through what each of these entails?
Certainly, the tracer process is designed to be a multifaceted approach to gathering information.
Okay.
The first step is review.
All right.
This involves examining various documents that provide the framework for the organization's quality and safety initiatives.
Okay.
This includes things like their quality improvement plans, documentation of staff credentials and training policy and procedure manuals, the hospital's drug formulary, their list of approved medications,
Right.
and various logbooks that track important activities and events.
Okay.
The review also takes into account whether the organization has the necessary policies and procedures in place based on relevant healthcare standards.
So it's about establishing a baseline understanding of the organization's documented processes and standards.
Exactly.
What comes after the review stage?
Next phase is the interview process.
Okay.
This involves speaking directly with a wide range of individuals within the organization. Depending on the specific tracer being conducted, this might include pharmacy directors, members of the Pharmacy and Therapeutics Committee, pharmacy technicians, physicians, nurses, and even patients themselves, as well as their family members.
Wow.
The key here is that the tracer tool should actually provide specific questions to be asked during these interviews
Oh, interesting.
to ensure that the necessary information and insights are gathered in a consistent way.
So it's a structured conversation
Right.
aimed at getting different perspectives from those involved in the processes.
That's right.
And the final component is view.
Yes.
What does that entail?
The view component is all about direct observation of processes in action.
Okay.
This involves going into various areas of the healthcare facility to see firsthand how things are done. For a medication tracer, for instance, this could mean observing activities in the central pharmacy satellite pharmacies located in patient care areas, medication preparation rooms, medication storage areas, and even examining the contents and organization of or emergency medication carts in critical care units. These observations focus on a number of factors, such as whether there is adequate space for staff to work safely and efficiently, the cleanliness and organization of these areas, the environmental controls like ventilation and humidity levels, the adequacy of lighting, the security measures in place to prevent diversion of medications, fire safety provisions, and how medications are actually dispensed within the pharmacy.
Okay.
This might also include looking at specific pharmacy equipment like refrigerators for temperature-sensitive medications,
Right.
laminar flow hoods used for preparing sterile medications, medication carts used on the floors, and the functionality of the information technology systems used in the pharmacy.
It sounds like each of these steps, review, interview, and view, provide a unique and essential layer of understanding,
They do.
creating a much richer picture than any single method could offer.
Absolutely.
Now, the briefing goes into some key considerations within specific tracers, using the medication tracer as a primary example.
Right.
What are some of those crucial aspects they look at?
Within the medication tracer, several key areas come under scrutiny. Pharmacy safety is of utmost importance.
Okay.
This includes ensuring that all medications are properly labeled with clear identification of the patient drug name strength and any necessary warnings, including barcoding for automated dispensing systems.
Right.
It also involves ensuring that high-risk medications and those with look-alike or sound-alike names are clearly distinguished to prevent potential errors,
Yeah.
and verifying that flammable materials are stored appropriately away from any sources of ignition.
That makes sense.
Another vital aspect is the drug list, also known as the formulary.
Okay. The formulary.
Here, they will review the policies that govern how medications are selected for inclusion on the formulary, the process for their approval, and how the formulary is managed and updated regularly.
Those all sound like fundamental elements for ensuring the safe and effective use of medications.
There.
What other areas does the medication tracer investigate?
They also closely examine drug ordering or prescribing practices. This involves verifying who has the authority to prescribe medications within the organization and the scope of their prescribing privileges.
Gotcha.
They also review the essential elements that should be included in every prescription. To ensure clarity and prevent errors, emphasizing the importance of including details like the date and time the order was written, the drug's official pharmacological name, its concentration, the prescribed dosage, the frequency of administration, the rate of flow if it's an intravenous infusion, the start date and duration of therapy, any relevant notes about potential side effects or relationships to meals, and whether there are any specific instructions for nursing staff, such as checking a patient's pulse or PT-INR, before administering the medication.
Wow.
They also specifically look for the absence of abbreviations that are on the do not use list and any other unapproved abbreviations,
Okay.
as well as the overall clarity and legibility of the handwritten or electronic prescription to avoid any potential misinterpretations.
The level of detail they look at is really striking.
It is very thorough.
What about the actual act of giving the medication to the patient?
Drug administration is another critical area of focus here. They might observe healthcare staff to ensure they are following proper hand hygiene protocols, using gloves when indicated, making any necessary specific instructions or explanations to the patient during administration, and most importantly, verifying the 6 rights of medication administration, ensuring they're giving the right medication to the right patient in the right concentration and the right dose, via the right route and at the right time.
It's clear that the medication tracer offers a truly in-depth understanding of the entire medication management process. Now let's go back to the infection control tracer.
Okay.
The briefing mentioned that it blends individual patient tracing with broader group discussions.
Right.
Could you elaborate on that integration?
Yes. The infection control tracer often includes looking at the specific care provided to patients who have active infections,
Okay.
which is the individual tracing aspect. This might involve reviewing the medications they are receiving to treat the infection and their overall plan of care related to infection control. However, a significant component of this tracer is evaluating the organization's overall approach to preventing the spread of infections within its facilities.
Right.
This includes reviewing things like the timeliness of laboratory results related to infections, verifying that existing infections were appropriately identified and assessed upon a patient's admission to the hospital, and confirming that staff consistently adhere to universal precautions, basic infection prevention practices like hand hygiene and the use of gloves when necessary,
Right.
and proper techniques for invasive procedures like blood draws.
And the group discussion aspect, who typically participates in those and what are the key topics of conversation?
The facility tour component of the infection control tracer involves discussing various aspects of infection control with both clinical and support staff in different areas of the healthcare setting,
Okay.
which could include patient rooms, the admitting department, the pharmacy, the dietary services, the laundry, and the general dining areas. The group discussion brings together a diverse group of individuals, including physicians, nurses, pharmacists, laboratory technicians, other clinical staff, as well as representatives from dietary laundry services,
Okay.
the quality improvement department, those responsible for maintaining the physical plant organizational leaders, and of course the individual who leads the infection control program.
That's quite the view.
It's a very multidisciplinary approach.
That sounds like a very holistic way to understand and address infection control challenges within an organization.
Absolutely.
Now let's turn our attention to the data use tracer.
Okay.
What are some of the primary discussion points during those interactive group sessions?
The data use tracer focuses on a range of topics, all centered around how the organization effectively utilizes data for continuous improvement. This includes discussions related to their performance improvement initiatives and data from standardized measures. A key focus is understanding how leaders across the organization use data to make informed decisions about prioritizing efforts to enhance the quality of care and patient safety.
Okay.
They will also discuss the methods they employ to report these data and findings to leadership, how they disseminate important information and involve the relevant medical and clinical staff in the process, and what specific actions they have implemented to address any identified opportunities for improvement.
Gotcha.
Other important discussion points include the mechanisms for data interpretation and reporting, the specific data analysis methodologies they use, and any related training provided to staff, how they transmit data to external entities, if required, the methods they use for data collection, including the safeguards they have in place to ensure data integrity, quality, confidentiality, and security.
Wow.
They will also discuss the specific performance measures that the organization is currently tracking and the organization's overall approach to assessing staffing effectiveness in inpatient care areas, and how that data is then used to inform staffing decisions.
It's truly eye-opening to see how these different system tracers hone in on distinct yet interconnected facets of healthcare quality.
Yes.
The briefing concludes with a really compelling statement. We can learn more in a few hours of tracing than in many hours of chart review.
Absolutely.
Could you elaborate on the reasoning behind that statement?
That statement really emphasizes the dynamic and comprehensive nature of the tracer methodology. While traditional chart review provides a detailed retrospective look at individual patient encounters, it often examines isolated events.
Okay.
Tracing, on the other hand, allows you to observe processes in real time, understand the interplay between different parts of the healthcare system, and hear directly from the individuals involved in those processes.
I see.
It provides what the briefing aptly calls an organization wrap-up, a much more integrated and insightful understanding of how things actually work, or perhaps don't work as effectively as they could across the entire organization. It's not just a static snapshot in time. It's a thorough and real live tour of the underlying systems and processes that directly impact patient care.
That's a really powerful way to put it. It's about seeing the interconnectedness.
Yes.
And getting a holistic view.
Precisely.
So the system tracer methodology, as outlined by the Tary Quality Team, really provides a robust and dynamic approach to truly understanding and improving the quality of care within a healthcare organization.
Yes, it does.
By examining the interconnected systems and processes rather than just individual patient cases, organizations can gain a much deeper insight into both their areas of strength and those critical areas that require attention and improvement.
That's right.
It really prompts you to consider how this process-oriented approach could be applied in various healthcare settings,
Right.
and the incredibly valuable insights it could uncover. For more information about Tary and our ongoing commitment to quality and medical health technology, please do visit our website at tary.care. Thank you for joining us for this insightful exploration into the system tracer methodology.
It was my pleasure.